Hi everyone, it's Nick here from Noterro. Today I'm going to explain patient snapshots and how you would use them. So first you'd do is you'd click on the person's name like Mike Jones and it's going to load the patient snapshot page. And snapshots are broken up into conditions, injuries, medications, surgeries, and other items that you want to track. So this gives you a quick overview of Mike Jones. And there's two ways that you can add items to the snapshots. One is by clicking the plus button, and the other way is reviewing forms that the person has submitted or completed. And so we're in the form section right here. We can see that there's a drop down and there are a number of forms that he has completed. And so we have a chiropractic, a clinic intake, a COVID, and a physiotherapy. So we're on the physiotherapy right now, and he has selected low back. So he is complaining of low back pain. And what I can do is I can click on pin items, and what I'm going to do is I'm going to pin low back pain, and he put it was radiating pain down his right leg, and it's in the conditions category. So I'm going to save it, and it's been moved to pinned items. So you can see that the low back has this little pin icon, and what I've done is I moved it to the pinned items, and this acts as a queue. So anytime that you want to deal with these items, you can move them down into the snapshots. So you can review all your forms, move everything over to the pinned items, and it acts as a holding area or a queue for when you're ready to move them into the snapshots or that overview. And so if I click on some of these other ones like the COVID screening, so this one he's going to be doing on a number of times, I'm just going to leave these items. I'm not going to pin them. I don't want to track these items necessarily. And if I ever want to see the details of the COVID screening, I can click either on the COVID screening here, or I can click on the intake form here. So I'm not going to pin any items for the COVID screening. If I go to the other one, like the clinic intake, you can see I've already pinned some items. So I pinned headaches, high blood pressure. I've decided I don't want to pin that item. In the right shoulder, I'm going to leave that for now, in the diabetes. So I'm going to leave those items. And what I'm going to do is I'll move on to my next form, and it'll be the chiropractic. And in this case, I have a left knee, so I'm going to pin the left knee. I'm going to put the left knee, and it was twisted on the weekend. You can see that. So I'm going to move that over. And I can see what the other chiropractic form, and I already have an item that I've pinned, and I'm going to leave the neck. So actually maybe I want to pin the neck, and I'll just put that in there. So I've reviewed all my forms, and what I have now are items that I can have in queue here, that I have a queue up. I have a queue going, and I can move it at any time that I want to move it into that snapshot area. So in this case, I'm going to move the neck into the snapshot because that's what I'm going to be treating him for over the next couple weeks. And so I can either hover over and I can click here to move to snapshot, or I can unpin it, or I can click on it, and I can do the same sort of thing. So when I click on it, I get a bit more detail. So it's from the chiropractic form, and he had that burning pain. And so I'll just move this to the snapshot, and I can edit this item if I want to. And it also gives me a few other options here. I could update it if I wanted to. I can move it to different areas. So I'm just going to move it to the snapshot as is. Okay, so that's been moved, and I'm going to collapse this section, and now I'll go into my snapshot. So now when it loads this page, I can see that I'm treating Mike for his neck, right side of neck, right shoulder, and neck. I have no injuries or medications, but maybe at some point he was taking a medication. So let me just take let's take a quick look at the history. And I can see that he was on aspirin at one time, and the aspirin was PRN, and then at some point he no longer needed it, and it was resolved. So I'll just close that off. And surgeries, likewise, I mean, there's no history because it's grayed out. So whenever you see this, you know that there's a history. And I can add medications if I wanted to. So again, say he was taking a medication. This time he's off the aspirin, and he's taking Tylenol, and I'm going to put it in pain category. I already have the pain category, so I'm going to select that, and also as needed, and I'm going to save that. So his medication now has been, I can see very quickly what I'm treating him for, the medications he's on, if I want to take a look at the history. So I can add a pin here. I can click on it at any time and see the history. So I can see the history individually, any changes made over time. So I'll close that. or I can see the history of the whole section here of conditions. So I'll just click on this, and I can see all the history of basically in this section of conditions of what has been added or at any time. Okay, so you have some exposure here, and when you're creating a note, you also have. So if I go to a draft note here that's already been started. And it opens up. I also have visibility of the patient snapshot. So if at any time I don't remember what was in that snapshot, I can always take a look as well in the snapshot. And I can also hide it from this section here. So, snapshot, I want to hide it. So I can also hide it from the note when I'm in the note. So I'll go back to the note section, and it'll take me back into the note, and then I can go to the snapshot. And it is where I left it, and I can see exactly what I'm treating, and I can mark any of these resolved. So if I have two necks here, for example, so I might want to remove one of these or update one of these, and I can just mark this one as resolved because I already have one, possibly from another intake form or another form that the person has been completing, because that also could happen if they've completed a number of forms. So you can clean this up, and so you don't have any duplicates, and then you can mark it as resolved. And then at any point, again, if you want to see the ones that have been resolved, you can just click on this little button here. It will show you everything that's been resolved, and you can unclick it, and it'll remove it. And likewise, you can also see the comments very quickly if you needed to see the comments. So that's how you'd use patient snapshots.